autism spectrum disorder is a disorder that has core difficulties with social emotional reciprocity, or being able to understand social nuance, being able to freely go back and forth in social interactions. The following two bullets are the criteria that we see in the DSM, which is the manual that we use to be able to make a diagnosis of autism. And so as you can see, the two main areas are social communication, or being able, again, to understand social relationships and to be able to use communication, both verbally and non-verbally, to be successful in social interactions. And then the last area is restricted and repetitive behaviors, or RRBs for short. And so sometimes people get confused as to why RRBs, or restricted and repetitive behaviors, are included in a diagnosis of autism. And so part of what we're going to be doing tonight is understanding how all of these things fit together and where some of these difficulties are coming from, so that we're all understanding how to best support individuals. Okay, so again, autism spectrum disorder is a neurodevelopmental disorder. And so this is why before we were talking about neuropsychological underpinnings. Autism is part of a group of neurodevelopmental disorders. Other things include ADHD, or attention deficit hyperactivity disorder, for example, sensory processing issues, speech and language issues as well. And so there is a large number of neurological underpinnings to neurodevelopmental disorders. And so, again, there are many things that have a neuropsychological root, which is what we're going to be talking about a little bit later. There is also a large genetic component, and because it is part of a bigger constellation of neurodevelopmental disorders, you'll often notice that it overlaps with many other diagnoses. So it's not uncommon, especially for me as an assessor, to see children a little bit later in life who have had multiple other diagnoses. And even though a lot of times parents start noticing differences in the first 2 years of life, sometimes not everything is as well understood until later, especially for higher functioning individuals, or for example, cisgender girls are often diagnosed significantly later than cisgender boys. So one of the important things in clinical psychology, for example, is to help understand all these different components to say what might be causing these difficulties and how do we address them in a way that's comprehensive and not just targeting one area, but understanding the child or the individual as a whole. Okay. So another important thing to keep in mind is that we're looking at a spectrum. And so one of the reasons why the diagnosis changed from autistic disorder and Asperger's disorder to autism spectrum disorder is to acknowledge the fact that everything lies upon a spectrum. And so again, we are not trying to pathologize the wide range of behaviors that we see, the neurodiversity that is part of what makes us as humans unique and special. What we're looking at is when behaviors or other symptoms are causing clinically significant difficulties, or areas that are making it harder for them, for an individual, to be able to participate in what they need to do to be successful. And so there are normal behaviors, or behaviors that are widely seen or commonly seen. There are atypical behaviors, or behaviors that are unique or don't lie within the spectrum of what we normally see. And then there are clinically significant behaviors. And so with autism, we're looking at particular clusters of behaviors that go together that altogether equal autism spectrum disorder. So this concept of spectrum and how this is also going to be important for some of the things that we're going to talk about later. But in general, understanding that we are looking at behavior along that continuum is an important concept to think about. Because again, we don't want people to think again that we're just saying, well, this is not what's normally seen, therefore it's problematic. It's again, trying to remove barriers for people.